I'd like to give a warm welcome to everyone to our virtual fireside chat, or Kamingespräch as we call it in German. And today's topic is as current as it is urgent, since it goes by the title Climate Change and Global Health, What About Malaria? In 1 week's time, the United Nations Climate Change Conference is going to begin, and most discussions center upon the very important task to reduce the speed of global warming. That goal in itself is, of course, of utmost importance. However, today, we would like to shed light on a topic that gets relatively little attention, namely the impact of climate change on global health and on the spread of infectious diseases such as malaria, but also dengue, Zika, and many more. When we take a look at malaria and the World Malaria Report of 2022, the World Health Organization reports 247 million malaria cases worldwide for the year 2021, with a global death toll of 619,000. Sadly, children under the age of 5 account for 80% of these deaths. As it is too often the case, the most vulnerable suffer the most from malaria, and tragically, the current situation is worsening due to climate change and its consequences. Or extreme weather events occur more frequently and on average are more severe compared to previous times. For instance, the catastrophic floods in Pakistan last year led to a sharp increase of malaria infections and an 8-fold increase in the number of deaths in the affected subnational regions. At the same time, such disastrous events and their detrimental effects on not only the healthcare system, but also the society at large, leave the most vulnerable people even more exposed to other health problems as well. What is more, the changing climate of our planet does not only negatively affect the fight against infectious diseases like malaria through extreme weather events, rising temperatures additionally lead to the expansion of suiting habitats for mosquitoes, which are the vectors transmitting malaria and a multitude of other diseases to humans. For example, the increasing spread of mosquitoes stemming from Asia on the African continent is highly problematic because these vectors are more resistant against proven methods to contain them. In these regards, and as we all know, climate change is a cross-cutting issue, and likewise is global health. Therefore, bringing both topics together is challenging as well as necessary. In order to do so, we want to make a small contribution to this effort by holding this conversation, and I am looking forward to an interesting discussion. Finally, I would like to say many thanks to everyone involved in making this virtual fireside chat happen, especially with a view on the cooperation between the two expert groups, Lobby and Pharma, as well as the audience, and of course our distinguished guests who are representatives from civil society, the German Parliament, the Global Fund, and UNITAID. On a related note, I also want to invite all of you to have a look at the videos produced by Action Against AIDS Germany in collaboration with community activists on the topic of climate change and its impacts on global health. Now, and without further ado, I want to give the word to my dear colleague, Peter Wiesner.
Yes, thank you, Tilman Rüppel, board member of Action Against AIDS. I'm an employee of Action Against AIDS. And just a few words what the concept of a fireside chat indicates and what we want to achieve. We don't want to have heated debates as we see it so often on TV. We are not going to grill anyone. We want to have a relaxed and a constructive discussion here. So that's why we name that discussion Fireside Chat. Some housekeeping rules. So as you already noticed, the conversation will be in English. We have strictly 1 hour time, so it won't be longer, and we ask everyone to be as precise and concentrated as possible, and stick with the 5 minutes for each question. This call will be recorded and made public afterwards, probably in the afternoon. If you are not in a speaking role, then please switch off your microphone and the camera if possible. And without further ado, I just hand it over to both very nice moderators, Tanja Siebenbrot from DSW and Max Klein from Buko Pharma Kampagne. Over to you. I'm excited about this discussion, so let's start it. Thank you.
Yeah, thanks a lot, and a warm welcome to all of you. My name is Tanja Siebenbrot. I work as advocacy officer at Deutsche Stiftung Weltbevölkerung, in short DSW, and the English translation means German Foundation for World Populations. And yeah, I have the pleasure to co-moderate this discussion together with my colleague Max. So I head over to you, Max.
Thank you very much. My name is Max Klein. I work for an NGO called Buko Pharma Kampagne. I also coordinate the so-called Memento Alliance, and am also active, obviously, for Action Against AIDS Germany. And just a word of warning, I'm in the middle of a cold, so if I sneeze or cough in between, don't get distracted, please. I'm all right. It's just the way it goes currently. So I'm very happy that we have such an interesting panel together today to discuss with us. And I think it's best if you could introduce yourself just very quickly yourself. I think we should start with Lynette, please. The floor is yours for introduction.
Good morning, everybody. Can you hear me? Can you hear me?
Yes.
Yes.
Great. Yes, it works.
We can hear you, yes.
Okay. Good morning, everybody. My name is Lynette, and I serve on the United board as live in Cape Town, and I represent NGO delegations on the United board. I'm very pleased to be with you this morning. Thank you for inviting me.
Thank you so much. And our next panelist is Diane Stewart from the Global Fund. So yeah, Diane, please introduce yourself.
Good morning, everybody. Yes, Diane Stewart. I'm the Deputy Director in External Relations and Communications at the Global Fund, and responsible for our replenishment process and donor relations. So very happy to be with you this morning.
Thank you so much. Next in line would be, and now we know how it's properly pronounced, Vincent. Please go ahead.
Good morning, everyone. So my name is Vincent Bretin, or Vincent. I'm the Director of Results at United, so in charge of the impact monitoring and evaluation work, a member of the senior management team, and in charge of our climate and health work, which is what brings us today. Pleasure to be here.
Yeah, thanks so much. And our last panelist in line is Mr. Wagner. So Mr. Wagner, please introduce yourself also.
Good morning, everyone, and thank you for having me. My name is Johannes Wagner. I am member of the parliament in Germany for the Green Party, and by training, I'm a doctor, and I was working as a pediatrician before joining parliament in Germany.
Thank you very much. So that is an illustrious round, and I think that's why we should go quickly to the first questions, because we have a lot of questions for you, of course. It's a challenging topic, as Tillman already said in the beginning, and I think our first question would go to Lynette, because Lynette, you're a member of Unitaid's NGO constituency. You live in South Africa, and we would like to know how the debates on climate change on the one hand and health on the other, I mean, they take place quite often in very different communities, sometimes even in different bubbles, unfortunately. So quite often it lacks synergy then. So what are the health impacts on the one hand of climate change for the communities that you represent in your region as a member of Unitaid's NGO constituency? And what particularly do you think about the fight against malaria and NTDs when it comes to that complex and yes, also the different bubbles that I mentioned in the beginning?
Thank you very much for the question. I mean, you know, sadly, well, I do not come from a malaria endemic country myself. South Africa does not have a lot of malaria. We've got mosquitoes, but they're not really as dangerous. But I think with the climate change situation, we're seeing them actually moving into South Africa, and people don't know how to deal with them. So I'll speak from a SADC and East African perspective, because that is where I do most of my consulting work with other civil society. Malaria, I think, has suffered quite a siloed approach for many years in a lot of the countries. So while I think HIV and TB have gotten more attention, malaria has gotten less attention. And as you've mentioned before, when your colleague did the introduction, we see that children are the ones that mostly suffer from this. So, and that the problem is that, you know, the systems that are set in place are not solid enough to have a strong referral system from when the child gets something at home to making sure that they get to a healthcare facility on time. This has been devastating to many parents because they think the child just has a cold. So we've lost a lot of children to malaria. In high malaria burden countries, what we've seen though is that where we've got support from, for instance, the Global Fund, we've been very able, as well as the Alma Foundation, we've been able to make a lot of proactive change, and there has been a lot of community involvement doing that work. Again, it has been a siloed approach. So what has happened is over the last 5 years, I would say, there has been kind of like an agreement to start synergizing and integrating. So the first piece of work that I think has really done brilliantly to do this has been, number one, a meeting that was held by the Global Fund in Bangkok late last year. And that basically brought all the civil society together who are working in malaria so that they could learn from civil society in HIV and in TB how to do community-led monitoring. They discussed various modalities that exist, because this is very important. When I think healthcare workers or community care workers and civil society do malaria kind of like advocacy at a national level, they focus on one thing. So they don't focus on a plethora of issues that are intertwined and are very important to look at, you know, including whether or not you also do screening for TB, you also do testing for HIV while you're doing your vector control work. And that has helped quite a lot in terms of getting kind of like, number one, the referral systems improved. Secondly, what's happened is that, you know, now we've got actually a vaccine that works. And thanks to UNITAID, to be honest, and a lot of partners, but initially UNITAID for actually using this or having use of the Oxford vaccine for children. This has really, really changed, has been a game changer in a lot of countries. And I know a lot of you have seen how, you know, this was supposed to be a pilot in 3 countries, and generally with UNITAID pilots, you know, they take about 2 to 3 years. This pilot literally took 2.5, not even 2 years, and other countries wanted it. And other partners came to the table and said, how do we expand this? Because this is a game changer, and that has been the game changer. Now that we're seeing a lot more climate change, especially climate change effects, especially in Southern and East Africa, all of those are kind of like grinding down and are coming towards even South Africa. For instance, in South Africa, we now face cholera, something people aren't used to, right? So they don't know how to respond to it. So as civil society, I think you no longer are able or have the opportunity or luxury to comfortably sit and work in your little silo, in your little corner. It's all about how do you work across different networks to bring everybody together in order for us to have a response to climate change, number one, to understand its impacts, number two, to understand what's happening at global level in terms of the COP discussions and the various discussions, especially people who aren't familiar with the fact that, you know, we've got the IPPR report and so forth. You know, we do have mechanisms. And lastly, to start working together to find integrated and cross-cutting advocacy areas that we can work on. So you're no longer doing, for instance, resource mobilization on TB or HIV, but you're also doing resource mobilization around those areas, HIV, TB, and malaria, but making sure that you are incorporating climate change. Thank you.
Thank you very much. I think this call for synergies and to get out of this silo approaches will be echoed more often during this event, I guess, because that's a very important point to still make. So I just realized I jumped in line. I was so eager to get the discussion started that I actually stole the first question from my colleague Tanya. I'm sorry, I'm a terrible co-moderator. Just take it as a sign of my motivation, despite the cold. So that's why I would also now do the second question, so that we just get in line in the right rhythm again. Thank you so much, Lynette, for that input. I think that was very, very interesting, and I would also directly connect to that with a question to Diane, because Diane, you are the Deputy Director of the Global Fund, and now we've been hearing about some of the challenges, and also especially the challenges of getting out of our silo thinking, so to say. You've been working in the field of global health for really many years. So what would you say are the specific impacts of climate change on the Global Fund programs to fight malaria and TB, and how is the Global Fund responding to the challenges we've also already mapped to a certain degree? Of course, you can also add some more that are important from your perspective. Thank you.
Thanks very much, Max. And yes, I think Tilman and Lynette have already set up quite a good discussion here with some of the issues raised. So, but maybe let me concentrate on the question that you asked for now, because I think it's important to get the scale of the impact that we see on our programming and sort of our immediate response. But I hope we do get later in the conversation to talking about some of the synergies and what we need to do together. But first, maybe just to say, we really are seeing huge impacts of climate change, particularly on malaria. And I think malaria is going to be a little bit of a litmus test about whether we can actually put in place mitigation and adaptation modalities for climate change's effects on the health investments we've been making collectively for the last sort of 20, 30 years. And we've seen so much progress against malaria, and now it's really slipping from our grasp so quickly that it's actually quite terrifying. And we had a discussion on this at our board meeting last week. And I have to say, you mentioned I've been in this business a long time. It was the first time we were really having a serious conversation about potential reversals of all of the gains that we've made, and the fact that it's happening so quickly that we're not sure we can get action in place in time to really change the patterns. Already, malaria was in trouble, right? 95% of malaria infections and deaths occur in sub-Saharan Africa, which is really where most of the most climate-sensitive countries are. And since the vast majority of these people are under 5, it's actually the people who have done least to contribute to climate change who are going to be feeling the effects most specifically. So we've seen all the modeling about who will be at risk for malaria transmission. And if you overlay that with the most climate vulnerable countries, you have a perfect storm of issues happening. Not just the effect on malaria, but also the effect on TB. So what we're seeing is increasing vulnerability to TB, not just because of the effects of air pollution and urban environments and so on, but more particularly because of migration and displacement, actually. And so what we're seeing is disruption to diagnosis, finding missing cases, and so on, which has been our focus for the last few years, and finding interruption of treatment and so on, as people move away from their homes, whether it's droughts or floods. And that is amplifying drug-resistant TB, but also interrupting treatment, leading to more undiagnosed cases, and then, of course, very poor treatment outcomes. We're also seeing overcrowding in refugee camps or through displaced populations, which, of course, is perfect fuel for TB transmission. And the other thing we're seeing across the board for AIDS, TB, and malaria, and frankly, health outcomes, is the impact of food insecurity and malnutrition. So what you have in places like northern Nigeria is a huge malaria burden on under fives who are already poorly nourished. And so whereas they might be able to survive the malnourishment and they might be able to survive a bout of malaria, having the two together means that many more children are dying. So we have to think about not only the primary impacts of climate change, but the secondary knock-on impacts. So what are we doing about it? Well, 71% of Global Fund resources are already deployed in the 50 most climate vulnerable countries. So our footprint, as I said, is already completely matched to where the burdens are. And 87% of the global malaria burden and 87% of Global Fund allocations for malaria are in those 50 most vulnerable countries. And we have similar large percentage responsibilities for the TB burden. 55% of Global Fund TB allocations are in the 50 most climate vulnerable populations. In the short term, what we've been doing is using our emergency funding availability. And in fact, we've had to top up our emergency funding twice over the last 2 years because the rate of increase of these disasters is such that we constantly spending our entire budget. So 46% of our emergency fund allocation has been in rapid response to climate related disasters. Tillman mentioned the floods in Pakistan. 8 million people were displaced in that catastrophe, and 2,000 health facilities were damaged or destroyed. That is just wiping out decades of work. So we quickly deployed 30 million in emergency support for additional malaria control efforts in Pakistan. You saw a fourfold increase in malaria in a matter of months. And this is why I say the speed at which we're able to respond is really important. So we're investing in mobile units, health camps, and so on there. And the drought in Somalia is another example, I could say, where we provided immediate emergency support for 3,000 TB and MDR TB patients whose treatment was disrupted due to the drought and because they had to move into refugee camps. So that's just 2 examples of the kind of thing we're doing. Longer term, of course, we need to build out resilient, climate resilient health systems. We already spend about $1.5 billion a year on building resilient health systems. And we're doing both adaptation interventions and sort of long-term resiliency interventions in these countries. Some of the adaptation efforts we're doing are digitalizing health systems and particularly health records. In Malawi, it was a big catastrophe because they lost thousands of patient records in the floods. So digitizing and backing up those records is really important for individual patient management. And we're also investing in community health workers and community systems that can support people in the most remote locations. So when these climate crises happen, there is an army of community workers and community-based support services for the poorest and most vulnerable. And so, as Lynette was saying, building up that surround of community support is really important. But we're also doing mitigation interventions, as I said. So strengthening healthcare waste management. As you know, the healthcare system is a huge producer of waste. And we've done a huge amount to change packaging, change shipping, all sorts of things in that way to adapt. And strengthen the supply chain systems to be more resilient. So things like building out warehouses that put the most expensive and vulnerable medicines at the top of the shelves because they get washed away otherwise. But also we're noticing that there's a lot of medicines that don't do well above 30 degrees centigrade. So although we're not investing in air conditioning or anything like that, we're trying to build cooling systems within storage facilities because you're seeing storage facilities at 40, 45 degrees, 50 degrees centigrade where medicines can't survive. And then finally, solarization. Sorry, last point, solarization in healthcare facilities, which I think we all agree is really important. Sorry, I'll stop now.
All right. All right, thank you so much. No, it was very, very impressive, the challenges, but also the programs you sketched out and also the specific examples you mentioned that make it more visual, of course. And by that, I would hand over to Tanya, this time for real.
Yeah, thanks a lot. And now we would like, so the next question is for Vincent, or may I just call you Vincent maybe? You're the head of Unit 8 results team, and so we already learned a lot from Diane about the effects of climate change has on global fund programs, and from Lynette we already received some insights about concrete impacts on community levels. So please start briefly by explaining what Unit 8 is doing, and after that it would be great if you could elaborate a bit on the impact of climate change on Unit 8 programs and the programmatic responses. So the floor is yours.
Thank you so much, Tanya, for the question. So in short, Unit 8 is a WHO-hosted partnership. We're based in Geneva, actually in the same building than the Global Fund. And for the last 17 years, we've been working on health product introduction in low and middle income countries with a view to make the best and high quality health products available in an equitable way in low and middle income countries. And our work has focused on HIV, TB, malaria, and more other conditions like maternal and child health. We have, over the last 17 years, supported the introduction of more than 100 products, including new generation of bed nets, treatments for malaria, severe and mild malaria, the vaccine that was mentioned by Lynette, some other vector control tools as well. What does climate change mean to us? I think more and more we're seeing that it impacts pretty much every aspect of our work. And other speakers have already talked about the impact on mosquitoes. I like to start with the mosquito. Of course, the mosquitoes will be in places where they are not right now. And we need to realize it's not just about, we need to shift our programs, but we need to also start to reach to populations that are not used to deal with malaria, that don't have the tools, don't have the practices, don't have the knowledge to deal with malaria. It's a question of predictability as well. I've heard many health ministers from the Sahel region talking about the rainy season, which is the malaria season, being far more unpredictable now because of climate change and not knowing when to start and when to stop the programs related to malaria. The impact on communities is massive, and I think it's been said by Diane from the Global Fund that the map of climate impacts and climate vulnerabilities intersects very, very strongly with the map of inequities in terms of health access. And there are many impacts that I'm not going to detail here, but that are extremely important and many of them indirect. We've looked at pregnancy, for instance, and what the impact of climate change on pregnant women. And it's just daunting to see the many, many ways in which all sorts of climate impacts will make pregnancy far more risky and challenging. I want to maybe emphasize a little bit more the supply chain elements, which is sometimes overlooked when you look at the impact of climate change. And I'll take one example to show you what climate means to supply chain. On artemisinin combination therapy, which is the main treatment we give to treat malaria to hundreds of millions of people every year. Artemisinin-based therapies, the journey starts in China because one of the components, one of the ingredients of this treatment comes from a plant. That plant is cultivated in China. We know that climate change is going to make the climatic conditions for growing this plant more challenging. We may have dry periods, for instance, which will impact the yield of the plant and the concentration of the compound that we want from the plant in the future, with potentially some issues in terms of supply or the price at which we can access that ingredient. The journey continues because the product is manufactured in India, and the pharmaceutical sector in India happens to be very concentrated in a few economic regions where those sites have been developed. And actually 75% of the manufacturers of this treatment are in 2 regions of India that are subject to flood risk. The journey continues, of course, when the drugs are shipped to Africa mostly and other regions. And Diane mentioned heat stability. Malaria treatment happened to be one of the products that are particularly sensitive to heat. And therefore, thinking about what it means to better store, but also to think about alternative products is really essential. So what are we doing, Unit 8, about this? And sorry, before I get there, one last point. The reverse impact. Supply chains, health products contribute a big part of carbon emissions, but also other forms of pollutions. The health sector overall is close to 5% of the global emissions. 2/3 of that comes from supply chain, manufacturing and shipping the products. And we've done a study of 10 key products in our portfolio. And we see a lot of those impacts that are very clear. What are we doing? I'm very pleased to say that here in Brasilia, actually yesterday, we had our executive board meeting of UNITED. It wasn't the first time we talked about climate change, but this has been a recent conversation, just like the Global Fund. I'm very pleased to say that the board approved the climate and health strategy, which takes climate not as a side issue of UNITED, but as a central issue that we will mainstream in our work through the concept of what we call climate smart health products. So thinking about every aspect of our work, every aspect of health products, whether those are medicines, diagnostics, preventives, in any of the disease, through the lens of first, not being harmful to climate and the environment, second, being resilient and delivered as part of resilient supply chains, third, being responsive to needs, responsive to what communities are experiencing and the new needs that are emerging, and finally, being locally adapted, locally manufactured, and delivered in a way that is informed through local knowledge. The last point I want to make is, as part of this journey, we have also made important commitments to decarbonize our own work. We feel it's really important as an actor in this space, and we shouldn't be exempt from all of society efforts to decarbonize. We are committed to the Paris Agreement targets for the Secretariat as an organization, and we are doing the same with our portfolio of investment. UNITED has a 1.5 billion portfolio of investment, working with more than 40 grant implementers, and we have started the journey with all of them to decarbonize that portfolio of investment. Thank you.
Yeah, thank you so much for your perspectives and for sharing with us what UNITED is doing. And it's so good to hear that that you have now a strategy. And thank you so much for elaborating on the supply chain. I think we learned a lot. And now I hand over to Max again.
Yes, thank you. And I would like to ask the fourth panelists, which would be Mr. Johannes Wagner, who's representing the Green Party in the German Parliament, and who's very involved in a lot of global health discussions and different topics. What priority does climate change and health, like interconnected as a topic, have for your party, and to what extent is it discussed among parliamentarians, like generally in Germany, would be interesting. And I mean, we have a lot of competing issues and challenges in the moment for politics nationally and internationally. So it would also be interesting to know how does it play a role among all these other big competing issues. Thank you.
Thank you, Mr. Klein. You are right. We have a lot of other competing issues right now, but be very clear, every other issue is also be worsened by climate change and the climate crisis. So it affects all of the other crises as well. And as other panelists already mentioned, people who are migrating, refugees, of course, and how they can produce food, agricultural system, everything is affected by climate change. And it also is the reason for a lot of conflicts in some regions. But let's start from the first part of your question. So as you said, I'm a member of the German Parliament. I'm a member of the Green Party, and I'm not sure if all of you know, but I think it's similar more or less all around the world. The Green Party's main goal is to fight climate change. That's one of our main goals, and we are not doing this because we love the polar bear so much or the bees. They are also affected by climate change, but of course, because climate change is a threat to human health and to societies in general. So this topic plays a essential role within our party, within the discussions we are having, the different aspects of climate change, how it's affecting people. And I'm really very, very concerned about the current situation. Paris Agreement, everything was already mentioned, and how the world came together. Now we are just 1 week exactly ahead of the COP, which is starting in 1 week, where they are discussing how the Paris Agreement is going and how fossil fuel phase out is going, and it's actually not going very well. And I mean, I'm not sure if you have heard that in October, 200 journals asked the WHO to declare a health emergency due to climate change. So it's really, really a very, very serious problem. And actually, politicians all around the world are struggling how to deal with this topic. Within the Green Party, we are discussing it a lot. And actually also within this government, we're discussing it a lot. Just a few days ago, I was at a press conference where association in Germany is called KLUG, where the health workforce is organized, and they gave our health minister a statement where they say that we need to fight climate change in order to protect kids, because kids and also elderly people, but in this case, kids are affected a lot of climate change. And I mean, they have a very national focus, of course. And I, of course, as a national member of parliament, I have a national focus. Because already also in Germany, this is affecting people's health already now. But of course, and I'm also vice chair of the subcommittee on global health, we also need to have in mind the global perspective, where some countries are affected much more or have much less resources to deal with climate change. But to also be very clear, also in Germany, we feel it already. Yeah, we have heat waves, we have allergies, and in Europe, we had now cases of dengue, which were transmitted in Europe. So I learned it as a medical student, like a tropical disease. Right now we see in France, in Italy, in Spain, that certain tropical diseases are already spreading there and be transmitted there in these countries. I'm not sure what will happen about malaria. I was talking to experts about malaria just a few days ago. They said it might need a little more time, but of course also malaria could be, I mean, we had it in Europe 150 years ago as well, also in Germany. We will see what will happen. So it's a really, really serious topic. We take it very seriously, and we try also to talk about with other party members. A colleague of mine from the Social Democrat Party, we funded a subcommittee on One Health to really also bring this topic to other parliamentarians, because unfortunately we see that this topic, this connects is not so, this nexus is not so strong within other parties yet, but I think it's going to grow also in other parties.
Thank you very much also for connecting the national and the global level when it comes to this topic. And by that, I would introduce the second round of questions. It sounds very formal. This is not a committee, don't worry. The second round of asking you for your insights. Please, the next would be Lynette again. As a member of UNITAID's NGO constituency, to what extent can you contribute to respond to the many challenges we've already heard about? And I already also, in the first question to you, I spoke about this divide, the very sad divide actually, about between the global health movement and the climate change movement, or maybe we shouldn't call it divide, but a gap, maybe that's the better term. And what do you think how can it be addressed to overcome this gap? Thank you.
Yeah, it is a bit bright. No, thank you for the question. And I thank you very much. Oh, sorry, my earpiece fell out. And thank you very much, MP Wagner, for contextualizing the issues that we're facing. I mean, I think at current point, we don't have a choice. You know, it's either we do something or we all are eliminated. I recall, I mean, I think about 2 to 3 years ago, UNDP doing this amazing campaign. It was the best campaign that I've ever seen around climate change, where they would show you like the dinosaur and the human, and they were like, do you want to get there? Do we want to reach, is our goal to reach extinction as human beings? And I think the message that was carried home was to say, what are we doing together in order to do the adaptation and the mitigation part? Because I think we are unfortunately in a very bad state at current point. For civil society, I think number one, we would like to thank the German government for the contributions that they'd made through ACTA, especially through the therapeutics pillar, where we actually could provide oxygen. They helped quite a lot with that, and there was leadership from your government. So first, we always thank those who have kept us alive during the COVID-19 pandemic. When you needed oxygen, right? That's already a climate change issue. And what we've seen through that and through COVID-19 was how bad or the gap actually that we saw around accessible oxygen. So through that, through the contribution, we were able to actually work together with many partners, civil society included, to make sure that we come up with the Global Oxygen Alliance. And this, of course, came out of the Global Oxygen Resolution that was signed at the W Health Assembly last year, actually this year in June. And what this highlights is that we actually can have other ways of providing therapeutics, because it's very difficult to use the old ways because of the issues that we've all discussed, migration, heat stability, and so forth. So we had to come up with a mechanism that could still be used in children and adults, but that would work at a reduced price. So we're very happy to say that, or to report back that, United has actually managed to get a 20% reduction in liquid oxygen. There are plants now that are being built. So that means you don't have to worry about the gas anymore. It's already there. The liquid oxygen is readily available. This will reduce, I think, a lot of complexities that we're already facing, especially through through wars and migration and displacement. It would help civil society to understand the importance of the issue from a product perspective, because I think that also helps us quite a lot when you're not only understanding the disease, but understanding that there are products to treat the disease and how to sensitize governments in order for them to also do the same. The third thing that we've seen is that this liquid oxygen is now going to be actually made available to 120 countries. And those are the high burden countries that are facing these disasters. And that to us is very good, because we now have oxygen roadmaps in countries to see exactly where are the pinpoints and where should we be focusing. This global task force has been really good, and it's an alliance that is led by United, by Global Fund, by PAHO, as well as by Africa CDC. So we can see that it's got a wide range of partners that are coming from the important regions where we need to do this. And we do actually, I think, would be grateful for the German government to continue investing in this area of concern, because, even the Canadians have realized that without oxygen, we really will perish because of the climate change, right? We can't even find oxygen, even though we're supposed to have oxygen, but we don't. So we need this mechanism to really thrive. And in 2024, there are many initiatives that we have under this portfolio. And one thing that is really interesting that civil society are doing, which I mentioned earlier, is that through the Global Fund, a lot of civil society have learned about community-led monitoring. So they are collecting qualitative and quantitative data on the ground that is helping governments prepare better. So Vincent spoke about, some governments not even being sure on when to kind of bring about interventions when there is climate change related disasters at a domestic level. But with CLM, civil society are able to do this work better. And it's been work that is supported heavily by Global Fund. And it's not only, again, in malaria, it's in malaria, TB, and HIV. And I think what we'll start seeing from the Global Fund is an integrated approach of the three, having a CLM approach. I think that helps quite a lot to help have concrete data as to why we're having cholera in this part of Malawi, and what can we do to make sure that the cholera doesn't spread to other regions in Malawi. That is important in terms of surveillance. And I think just one thing, I would just like to say that this conversation needs to be situated within the pandemic accord. It is a UHC issue, it is a PPPR issue. So the fact that we have to beg the WHO to move with this. I think, especially for leaders such as Dr. Wagner, we can do it through the pandemic accord and ask for this issue to be heavily mentioned under One Health in the pandemic accord. I think that will be something that can get us the political traction we need to have better responses. Thank you.
Thank you very much. Also, the turn to the pandemic treaty, the pandemic accord at the end, that is quite interesting. Before I hand over to Tanya, just a quick update, because we have so many interesting topics and perspectives. We are a bit behind on the time, as usual in webinars, I would say. So please maybe shorten a bit your input so that we can, in the end, still have a compact seminar, so maybe limit 4 minutes as possible. And with that unthankful note, I hand over to you, Tanya.
Thanks. Yeah, so the next question is for you, Diane. And yeah, like during the discussion, it became clear that a lot of organizations, and also both organizations like the Global Fund and UNITAID, are dealing with the same challenges related to global health and climate change. And now we would like to know how our organizations are working together on these issues, and should more be done to create synergies and address these challenges jointly? So the floor is yours.
Thank you. And just to echo what Dr. Wagner said about the fact that it's both a local issue, a local and national issue for many political leaders, but it's also a global issue. We can't solve this locally or nationally. It has to be a global solution. So I think we're all trying to figure out what are the global, national, local partnerships that we need in order to address this. So the Global Fund is a partnership. We work in partnership. We have an incredibly complementary role in relation to UNITAID, as Vincent has mentioned. I'll keep it very brief because Lynette has also discussed the Global Oxygen Alliance, which we're very proud to lead and partner on. And a big thanks to Germany for the money for the COVID-19 response, which has enabled that massive scale up on oxygen in the poorest countries in the world. But two quick examples of how we work with UNITAID and other partners to bring scale. The Global Fund's role is scale, right? We're in 126 countries. And so when UNITAID manages to bring exciting new products to the market, like dual active ingredient mosquito bed nets that address resistance issues for mosquitoes, or seasonal malaria chemo prevention for under fives, those are two incredibly important new tools that the Global Fund is scaling up in the response to malaria. And where we've discovered that because we have to be more flexible in terms of when the seasonal malaria chemo prevention is provided, because the malaria season is moving and so on, it's really important that we have affordable new tools that we can use in the market. So we're very proud to partner with them on that. And the second example I would give is around supporting regional and local manufacturing. That's really important, not just because of the carbon footprint, but also because of access and availability issues. And we learned those very hard lessons during COVID. And so one of the examples of that is we're working with UNITAID, PEPFAR, and the Global Fund to accelerate the manufacturing of HIV rapid diagnostic tests in sub-Saharan Africa as the initial product that we're focusing on, obviously with a view to more products being available. But that's a good example of something that should be produced locally, available locally, more easily distributed. Let me leave it there, Tanya, so that we can fit in everybody.
Yeah, thanks a lot for your contribution. And I would hand over to Max so that he can continue.
All right, thank you. I would then ask Vincent basically the same question that we just asked Diane, but from your perspective now, because I would assume it's a different one, because how it is that your organization now works on tackling these issues together with other ones, and how should be more done to build synergies when we're talking about cooperation. and tackle the many mentioned challenges. That would be interesting to hear from you. Thank you.
Thank you so much, and I'll try to be quick as well. The first point I will make, and to echo what Mr. Wagner mentioned a little bit earlier, is the importance of the political agenda. I think coming together as a health community around the climate change agenda is fundamental. Really excited to see that there is a health day at COP next week, and we will be alongside with partners like the Global Fund present at COP and sharing our experience and also our plans around that. But I think that is a fundamental step that is happening, fortunately. And also the health argument for climate action, the fact that climate action will have consequences for health and good consequences, good benefits for health here and now is a key argument we need to bring forward. The second point I want to make is there are solutions. I think we tend to describe a lot of problems when we talk about climate change, but we've seen, for instance, when we studied those products, that there are solutions to reduce carbon footprints, that 40% of the emissions can be removed without increasing the cost of those products. Because of course, we don't want to pay the bed nets more. We don't want to pay the treatments more. We are already very constrained. But there are many things we can do, and those solutions are identified. There is green chemistry opportunities, for instance. You can rethink the way you manufacture a certain ingredient for a treatment in a way that takes fewer steps, fewer ingredients, that will save you money, pollute less the environment, and reduce the emissions associated to the manufacturing of a product. Lastly, around partnership, I think we've been working, and Diane mentioned that, as partners around product introduction for many, many years. And there are partnership models like the Oxygen Alliance, like some others, that we can build upon to tackle this work. We will need, just like we did for our regular work, we will need industry to play a key role. We will need countries and communities to explain what their needs are and drive the programs that they want. We will need regulations to evolve. Right now, regulations do not account, product regulations do not account for environmental considerations. So that will need to evolve as well. We will need to change our procurement practices, and we cannot do it, one agency doing it in a certain way, another agency doing it in another way. We need to together, as a global health, set of agencies procuring billions of dollars of products every year, to send strong signals to all the manufacturers of bed nets, of treatments, and explain what our expectations are and how over the years we're going to raise those expectations in terms of environment and climate. And finally, we need research, we need R&D, we need new products, we need better products, we need products that use recycled materials, we need products that address the challenges of tomorrow, the new mosquitoes, the new types of malaria, and where academia, of course, and private sector will play a key role.
Thank you very much. Given the fact that Mr. Wagner, I think, has to leave us at past, without further ado, please, Tanya, let him ask the last question, basically.
Yeah, we already talked about the Health Day at the COP, and we would like to know from you to what extent you have been involved in the process of this meeting, and is there an outcome what you are expecting, and do you think that the meeting will increase the understanding of the links between climate change and health?
So, yeah, unfortunately, I have to leave quite sharply at past, so I will also make it very quick. So first of all, it's a very, very good thing, very good news that there will be a health day at the COP. It's a big achievement, and it shows that it is understood that the climate crisis is a health crisis as well. Of course, we as parliamentarians, we are in contact with our ministries, and the ministries are planning the declaration. So there is a interlinkage, but it's also job of the ministries to prepare the whole process and the whole day. And our Minister for Health will also be there in Dubai, I think next weekend. This is the Health Day. What I want to point out, and I'm really excited that you, Mrs. Stewart and Mr. Britton, you are there, as I understood, or as your institutions are there, that this Health Day, of course, is a big success, but what's the goal of this Health Day? We have to bring the discussion that this climate crisis is a health crisis into the COP and discuss it there to have more, to be faster. That's very simple, to be faster in the fossil fuel phase out and to build renewable energies. That's the main goal of this whole topic, actually, to use this argumentation. I think you, Mrs. Stewart, you said it similarly. So to use this argumentation from a health perspective to speed up the whole process of climate protection, because the climate crisis is a global threat to health. And this is what I hope will be the impact of this declaration. It's not, the declaration itself is not part of the outcome document of the COP itself. So it's a different, let's say, different process and not legally binding or anything. But it can, of course, have an impact on the discussions, and then, of course, on the outcome of the COP. And I really need a strong outcome of this COP because, yeah, we cannot wait any longer. But this will be really tough negotiations. I mean, we all know where this COP is taking place and who is the president of this COP. And I think we have to have in mind that this will, it constantly needs people like you here in this room, like my co-panelists, who push for this agenda, and with your credibility which you have for your work, you influence and people to really be bold and to take bold decisions and to start and speed up the fossil fuel phase out.
Yeah, thank you so much for elaborating on the COP and for that. Yeah, the health, the climate crisis, or the health crisis, and yeah. So actually, we have planned a last statement round, but we would skip that round now for. Yeah, so that we can end this discussion punctually and that everyone can leave as they have to. So yeah, so thanks a lot to all your contributions, and it was a very interesting discussion. So I learned a lot. I think all of the participants also learned a lot. And now I would like to hand over. And I also would like to thank Max for the co-moderation, and once again thanks to all of the panelists. And now I would like to hand over to Marvin, another colleague from us, who will do a wrap up.
Yes, thank you very much for a fascinating discussion, and I really would like to make it short so that we can all leave on time. My name is Marvin Meyer. I work for World Vision Germany in the area of global health and displacement. I think it's very easy to, no, it's not easy to sum up, but the two things that really ring for me are both intersectionality and synergies. And I think we have explored where are the intersections, and our panelists have described this very, very well. And also, where are possibilities for more synergies? Just mentioning quickly again the community-led monitoring. With that said, I would also just to remind everybody that this kind of talk, our fireside chat, is going to be continued. Already on December 6th at 11, you are invited to join us again for a chat on what's happening in Uganda when criminalization makes you sick. This will be together with activists from Uganda, and we will be joined by Mrs. Tanja Rödiger-Vorwerk from the Ministry of Economic Cooperation and Development here in Germany, and also by Christine Stegling from UNAIDS. So with that, I'm basically very happy for this hour and would like to wish you all a very pleasant day ahead, a pleasant night, wherever you might be. And thanks again for all those attending.